But perhaps you could, thank you. Perhaps you could also put them into the chat, and we'd be happy to walk through those questions with you. If I could, I am going to display my screen and just walk through a slideshow. And Austin did introduce me already, but I'll just say that I've had the privilege of serving as the Medicaid director for the last now almost 20 months. It's been quite an enormous load of work, honestly, over the last year, specifically as our program has had so many changes. We've been in the public health emergency and had this continuous enrollment requirement. So our Medicaid population has grown to the highest rate it ever has reached. In March of this year, we began unwinding our Medicaid population, and pretty much simultaneous to unwinding, we also launched our new MMIS or PRISM system. And so the team has just been so busy, but they're so committed to the work that they're doing. And certainly you as our providers and our Medicaid members are so central to that work. And I just want you to know that that we consider it a privilege to serve this population and do the work that we are doing now, but recognizing this is a very big task we've taken on even in this past year by doing these two large changes at the same time. And so we need to hear from you. We need to take your questions, and we're here for that. But just to begin, oh gosh, you know, this won't even let me screen share actually, Austin. So let me see if I can get a team member who can quickly load this slideshow for me.
I was going to say, Jen, do you want to try that again? I made you the co-host otherwise as well on both of yours.
Like not able, I don't know what happened with my Zoom. I cannot screen share. Let me share.
This is Liz. I'm on the call. If you want to send me your slides, I can pull them up.
I'm going to share that right away. And Liz, what I'm going to do with this is actually on this slide deck, I won't go through all these slides, but I wanted to give an overview of the PRISM work that we've done so far. So I've shared those with you right now, Liz. So if you could pull those up, that would be wonderful. Thank you.
Is it a Google Doc, Jen?
It is. It's a Google slide deck.
Okay, give me a second.
Okay.
I got it.
So I mentioned to you, and I'm hoping for those of you on the call, we are we're in the midst of our PRISM implementation and our go live phases. We're also engaged in a large amount of work with our unwinding activities. But I really want to focus on our PRISM updates and then share with you some of our policy updates. So that's where I'd like to go today. So if we could just move into the first slide, it's more of an outline to share that I'd like to cover PRISM, give a brief unwinding update, go through statewide provider training, which is kicking off, and then some program changes that are occurring with our new program.
Jen.
What's that?
Can you see the slides?
Yep, we have them. Thank you. Okay. So let's go into PRISM updates. I know I want to give enough time for us to have Q&A. So if you could go to the next slide, Liz, and just go through our PRISM updates, and then the slide after that. As a background, this was one more slide, just backwards, one more, please. Other direction. There we go. And one more forward here. The system replacement that occurred, which is named PRISM, the Provider Reimbursement Information System for Medicaid, did go fully live on April 2023. We replaced a 40-year-old claims system with this new system. You know, and just to understand the context of this, for state Medicaid programs today, it's rarely done and almost never done where an almost full system replacement occurs at once. The approach that's happening now is just modules are done over time. And these implementations, I'm told from Jason, who's on this call, that can take almost 10 to 20 years to plan. Our system did take almost 10 years of work to prepare what we have gone live with. And so it is a massive change to our program, but certainly an enormous step forward with regard to modernizing and automating a system that is 40 years old. For context, in our Medicaid program, Medicaid processes 6 million provider claims and managed care encounters annually, totaling approximately $5 billion to more than 65,000 enrolled Medicaid providers. We serve over 500,000 Utahns with this system, but you can see the volume of work that is run through the system that we now call PRISM. Since our go live in April 2023, if you can move to the next slide, Liz, we have immediately from the start, you'll see that in April, we began processing millions of claims from month one. So at its go live, we had a 3-week freeze prior to our April launch date. And in our month of April, we processed over 2 million claims with about 585 million in payments. You'll see a little more payments and claims early on because of the backlog from the freeze timeframe. And so we're seeing early on that there's a huge volume of claims running through the system. And then we have May and June. So what we're seeing here right from the start is certainly while there were a volume of claims that were processed and certainly enormous changes that occurred in our system, right from the start, the system was fully functional and doing the work that it was designed to do. If you move to the next slide, what I wanted to focus on next were some of the claims systems processing items, just to tie into some of this claims processing and the dollars that we're moving through that. How are we doing as a program today? We are now 4 to 5 months post go live, and our call center is very busy. We have our call center, our director now for our Office of Operations on today, Shandy, and her team is really the front lines of provider calls. Her team is receiving about 10,000 calls per month. The volume certainly went high. Early on, we did extend our customer service times. We were up till 7 every night, taking phone calls, addressing questions, helping providers navigate the system and really troubleshoot the problems they were experiencing in our new system and the learning curve that certainly providers were experiencing. About 40% of providers dropped from calls. We had a 40% abandonment rate and a 28-minute average wait time. We can say that our July statistics actually have gotten better. We've seen those call center, the calls get and the abandonment rate go down just a little bit, but we're still experiencing a heavy call volume come in as we're troubleshooting calls, providing on the spot education to our providers and really helping troubleshoot with our new PRISM system. Another area that providers are facing, certainly a new change, is that our system is paperless. We are now electronic based system. And so what you're seeing with prior authorization specifically is that prior auths are to be entered directly into our system in a paperless fashion. This was certainly another learning curve where we've been receiving and processing prior authorizations through faxes all these years. And now with our PRISM system, the providers need to go into the system, enter the prior auth into the system, and they can actually see the status of the prior auth in the system, which is really a great new improvement with the system, because before they would have to call and find out, where is my PA, what's happening with it, how are things going. There was a huge volume of prior authorizations. In fact, our prior auth volume jumped with this. And in fact, we're processing now about 3,300 medical prior authorizations per month. Our system is our team is experiencing a backlog for a couple reasons. Number one, the first is that many providers continue to submit paper faxed prior authorizations. We did turn off the paper claims system, and we're no longer accepting those. as of August 1st. But up until that time, the team was still working two pathways. They were still taking those paper claims and manually working those claims, which was certainly a slower process, while at the same time they were learning the new process and managing them through the new system process as well. So what we found as a result of that, as well as a couple defects that were identified with the prior auth system, that this backlog did happen. While our system today, our prior auth team is sitting at about an 18-day turnaround time, that is higher than our goal of 7 days. And there are certain requests that are longer than 18 days, but our average turnaround time is 18 days. Our teams are working overtime. They are taking on extra calls. Liz, I'm seeing your screen, just so you know, I'm not seeing the presentation. But we have been able to catch up with some of that work. Our team is, certainly we have goals set in place to catch up on that backlog to make sure that the prior auths are being reviewed within a 7-day time frame. If we can move to the next slide, please, Liz. The next piece that I wanted to call out were some challenges that we're seeing from the provider side. We recognize that when we went live with our system, while we did try to engage providers and let them know, hey, these changes are happening, we definitely sent out newsletters. We had multimodal training resources available. We did live training sessions. We had electronic and digital resources on our Prism website. We actually even launched a quarter later than we expected because we were wanted to make sure that our providers did have appropriate training and knowledge. We knew that when we went live that it would be a learning curve for providers. And what we're seeing in our system, and just to compare and contrast our old system to our new system, is that our old system is 40 years old. Some of the things that our system allowed to process, our new system is meeting all the standards, the X12 standards with claims billing and claims adjudication, and our policy and our claims are processing differently than they did in our new system. So what we found is that a lot of our providers, number one, from a claims processing and billing standpoint, we're really submitting claims the way our old system allowed claims to process. And what we're finding is that providers had to have learn and understand how to put a place of service on claims, use modifiers in certain places, or meet those standards that were billing standards but weren't necessarily required in our old system, and that is required in our new system. So we've done a lot of on-the-spot training or directed our providers to training resources so that providers could learn and do this. Additionally, we've also found that even our provider enrollment, some of our providers, our new system actually requires a new hierarchy, so that if you're a specialist or provider in a certain field, that there are certain ways that your provider profile needs to be set up so that you can actually bill and function in our system. So that itself was a barrier, as well as some of our providers weren't set up in the system to be able to bill properly for some of the services that they've been billing for previously. So our provider enrollment team had a huge mountain of work early on, where we had thousands and thousands of applications that the provider enrollment team had to review to get providers set up in our new system properly, both with new applications as well as modifications to current Medicaid enrollment. I'm really proud of the work the team has done to get caught up and stay caught up. Now, if there's any provider enrollment changes that need to occur, we can do those reviews and changes within 7 days. And the team is able to keep right on top of that. One important aspect that I want to call out is we did put an extension on ORP providers. Early on in our system, ORP providers couldn't even bill in the system. They may not have been registered and enrolled, and this was a problem for accessing services. We did allow more flexibilities and a longer grace period for the retro enrollment, but that time is ending soon. As of October 5th, we will no longer allow our ORP providers. You have to be enrolled as a Medicaid provider to bill and work in the system. We are granting a 12-month retro enrollment extension, but if any of you are ORP providers or working with ORP providers, we need you to get in and do this provider enrollment application now. But regardless, getting back to some of the initial barriers that we're still experiencing are that provider enrollment needs to be set up properly, but also that claims are being billed correctly. Early on, we saw that denial rates were about 46% in April, where providers were billing for services, but the claims were denying correctly. Providers just weren't billing them correctly. We've seen that denial rate drop to 36%. So that tells us that we're actually getting some learning, and that the providers are learning to do that. And we're here to continue supporting you and creating resources and tools to help you with that process. On the other side of that, we know that some claims are also denying because of defects in our system. This is a little bit older data that actually shows that we found now this is just a little bit older, but we found about 1,500 defects since our system went live. If you were to look at a curve month by month of defects that were identified, we found a nice downtrend in the defects that were identified, but also the resolution of those defects. Today, we actually have a higher than 62% defect resolution. We just had a release that came out last night. So we are close to a 70% resolution rate with our defects that have been identified in the system. For those defects that have been identified, we have them on a roadmap so that a release is assigned. We have about only 9% now that are in process and that are still being worked up and addressed. So what we're seeing is that while our system went live, we did thousands and thousands of test claims were being tested and scenarios were being tested. But even after go live, we continued to do testing. We found defects, we're resolving those defects, and we're seeing that curve nicely flatten out as we move into now month 4, month 5 of our go live process. And so we're encouraged as we see these defects that we're addressing, we're seeing more and more claims process and things function as they're intended to do. One of the ways we've worked with providers and our partners to really improve communication around problems you may be experiencing that are defects in the system and the timeline for addressing those is that we have developed PRISM release notes that are provider facing and ready for you so that you can log in, see them, and actually see, oh, that's on the roadmap to be released in September, for example, or, oh, this is the time when I can address that problem or that question that I have. We are actively working through those. We are actually transparent in the way that we are addressing them and then also prioritizing those for resolution. So that is on our provider. We'll put that hyperlink into the chat so that you can see that and make sure you have access to that as well. We just completed what's going to be in our November release. So in our profile of what's coming down the road, we will soon be putting what's on the November roadmap as well. We have September in there. We have November coming soon. Additionally, we know that many of the defects or the suspended claims that are stuck, that you are not getting payments for and that are tied to a defect might have a manual workaround. So we are trying to work through those defects as we've identified problems with certain claim types. We are actually working manually to work around and work through that defect until our system can process it normally. And we are doing that through a manual workaround pathway. We have hired teams that are actively working those claims so that you can get payment on the provider side. We've also pushed out really millions of dollars in interim payments to providers who are really struggling and need additional support while we're working through some of these problems that you're experiencing either around enrollment, claims processing, and claims billing, or the defects that you're experiencing. So many of you on the call today have probably been working with us on these, but certainly we are doing that and are here to be able to work through some of those pathways with you as you're experiencing challenges and as we're still really coming to a more fully functional state with our PRISM program. Okay, so last thing I wanted to point out on the next slide is, Liz, if you'll move it to the next slide quickly, is our resources. We have put together through our planning phases prior to our go live and even post go live an abundant resource library for you as providers to use as your resources to be on the ground problem solving tools for you. I know it can be frustrating to call and sit on wait for us, while our customer service team loves and is certainly geared towards helping each and every provider with the problems you're experiencing. A lot of our online tools will answer those questions that you may have for you. And so we really want to direct you towards those resources. We've got trainings, we've got FAQs and guides. We have contact information, online resources, and portals that can help you and assist you. And we'd love to direct you to those as being a ready resource for you to support you with the PRISM work. So I know there's a lot of chat and jabber going on. A couple things. I'm going to now transition out of our PRISM work and just touch on Medicaid unwinding. I have a number of slides here, but for the purpose of time and just to make sure we're focused on what you would like us to talk about right now, I just want to give an update to our unwinding status. So Liz, if you could just move to the next slide and then move, I'll just say that from an unwinding perspective, if we could move, Liz, if you don't mind moving ahead one slide and maybe go to the next slide here. I'll say that through our June status, and this is a little bit older of a slide deck because I do now have July data, but what I want to say is that we have reviewed now there's about 500 when we began this work of reviewing all of our population as part of our work we're doing for our unwinding activities. Our goal is to review every single Medicaid member's eligibility over the next 12 months. We kicked off this activity in March of 2023. We have until the end of March 2024 to review more than 500,000 Medicaid enrollees eligibility. This is an enormous volume of work for both the Medicaid team and the Department of Workforce Services, who partners with us and does the eligibility reviews for us. Our status update through the end of June shows that 179,000 individuals have been reviewed. 81,000 of those have been renewed, and 98,000 individuals had been closed at that point in time that we pulled this data. Of those 98,000 individuals who have been closed, there is this opportunity for an individual who may have been closed on a certain date to have 90 days from their date of closure to submit their paperwork or any parts of their data that we need with regard to their income, their employment, or any of their pieces needed for their eligibility review. They have a 90-day window to submit that information and have retroactive enrollment to that date of closure. So it's actually as though they had continuous enrollment. 30% of individuals who have closed have been reinstated. So we have seen that people have responded to those closure notices, and they are submitting their paperwork and getting their applications completely processed to be reopened. Again, for the sake of time, I'd like to move to the next slide and talk about strategies. This has been a very large volume of work, and there's been a couple areas that we've been called out as areas of focus for us to really improve our customer service and our work around the closures. I'll first say that our procedural closure rate, individuals who have closed because they have failed to submit paperwork, that rate is much higher than we want it to be. We want our Medicaid members who are eligible for Medicaid to continue to receive their health benefits through Medicaid. In order to do so, we need the members to submit their paperwork, respond to notices when they get them, and be able to have continuous enrollment. Additionally, for individuals who've been able to transition to another program, we want them to understand that they're no longer eligible for Medicaid, but they may be eligible for another program. And so for you as providers and frontline staff, it's really important for us to have partnership with you in some of this work. And I know many of you are doing this. We have an abundant number of resources that can help you answer questions from Medicaid members so they know what to do and when to respond to those notices, when their review date happens, what to do when their review happens and they get a notice in the mail, that now is the time to respond to that notice, to submit that information to DWS, and to actually make sure that their application is complete so they continue to have their health coverage. Some challenges that we've had is that because of this enormous volume of work, much of it has been manual. And as a result of that, some of these pieces called ex parte, which is the ability to review a member's eligibility and continue to be able to continue their eligibility and their enrollment in the Medicaid program through an automated ex parte process. Some of the thing we're doing is system programming so that there's less manual work that the caseworker needs to do. This work should be done in the next few weeks so that automation can really take some of that hands-off work and make it hands-free, and so that the more individuals can be reviewed through the ex parte process. Also, we've been able to really look at some of that procedural data and identify that we can do some of our work better within our teams and have better quality control within the caseworkers who are doing that work, the eligibility workers. And we've been able to identify some key areas for training and for some improvement in the workflow and standardization of that work. Some of our data reporting as well has not been accurately capturing people who should truly close versus those who are procedural closures. So we're working to clean up some of our data. Last, we're working with our stakeholders more closely to make sure that there's opportunities. I see UHPP is on this call, but working closely with our ACO partners and those of you on the front lines to help coordinate care and services and help people with their eligibility process, help people with their application and their reviews. And as they get these questions and they feel like they've hit a place where they don't understand what to do or they're not sure, the pathway gets complicated. We recognize it's been 3 years where many of our Medicaid enrollees have not had to submit an application. They haven't had to fill out these forms, and it's confusing, it's challenging. And so we're really recruiting partnership in all the places that we can. And we thank you for the ways that you've really done that work with us, but we're kind of using some flexibilities to augment that work to really help Medicaid members get the pieces in place and get those questions answered and facilitate that process with them. I'm sensitive to time, and I know you have a lot, and we can certainly go through some other pieces, but I'd like to actually just guide you to the next slide that does have unwinding resources that are available that can be front facing. Everything having to do with unwinding, whether that's our publicly available dashboard that gives you our data metrics. These are data metrics that we have to publish for our legislature or to CMS as a result of doing this work. We also have numerous resources that we may send to our members, those that we've geared specifically to providers and those of you on the front lines, both in English and in Spanish, as well as many other resources that we would like to share with you. And here are the hyperlinks to those documents. With that, I'm going to stop. And so Liz, you can stop presenting. I do have other slides I could certainly go through, but for the just being sensitive on time, I'm going to stop and hand it over to some of the questions that have come in. And I know I see the team has done a really nice job working through these. So Shandy, maybe I can just hand over to you if you don't mind, and if you could take some of the questions that are coming in and see if there are other specific things that we could also troubleshoot with you.
Yeah. Hi.
And Jason as well. So I would, just to introduce, Jason Stewart is our operations director from our executive team. He really has led this PRISM project and been the PRISM project director really through the entirety of this project. He's done a great job. He is also oversees our operations for our Medicaid program. Shandy is our leader for our office, of our operations office, and both of these folks here and their staff are here to be front facing with you and help you with questions. So go ahead, Shandy, Jason, I'll just hand it over to you. Thank you everyone for the time to go through some slides.
Yeah. Hi, everyone. Jason, do you want to start or you want me to start?
Sure. Yeah, I think Jen did a great job covering kind of everything there. Just a few things I wanted to touch on is just around like our defects, as Jen mentioned there. So any new system, we're gonna have defects as we go along. And so we've gone through the process, like Jen had said, of just making sure that we're doing quick releases to get some of those problems found and resolved as we kind of find those. And so I know on that slide it mentioned release notes. I also put a link in there around that. And if you go to where that Prism FAQ is and click on that link, you'll see what is called release notes. And what those are is that's a list of all of the fixes that we have done for and when they went into place. And then we also have, so there's 2 reports on there. One of the other reports that's on there is a report that what's coming in the future. And so as Jen stated there, we just finished up planning for our November release. And so you can see those out there. So if you have questions as to when are things getting fixed, I was told by provider enrollment that this was an issue, or customer service, you can see kind of where those are scheduled to be resolved there. I know one of the questions I saw up above was around prior authorizations. We did make a change to the process in prior authorizations. We did initially have that porting into Prism. We have gone through and it just barely finished up this week. I think they're going through the very last steps on our side. We're actually moving that fax box back to the state and not having it go through our vendor for that. The issue that we were running into there most of the time is that each one of those faxes needed to have a separate spreadsheet, separate face sheet to those. And so if they didn't, they were coming in and replacing the ones that came in before. And so we've had discussions with them. And so for the time being, we are planning on having them come into that fax system, and they'll go ahead and push those into, the Prism system itself. So. And I think most of the other ones we've answered. I think there was a question. Do you want to talk, Shandy, a little bit real quick around the labs and what we're doing there?
Sure. Just based on what the questions were that were coming in, I'm kind of making an assumption and categorizing them that it sounds like your claims are possibly denying, not because the CLIA is invalid, but in the legacy system, the CLIA number was only validated that it was the right CLIA number. And so in Prism, there is a secondary level of editing that actually verifies that that CLIA has been assigned to that servicing location of the provider that they're billing. So it could be that you're not familiar with that second level of editing, and you want to make sure that when you go into your provider file, that CLIA number that's associated with the servicing location that you're billing for. If you don't feel that is the issue and you have validated that and you feel like there is still some questions regarding the denials for CLIA, Emily said she'll be willing to take a few claim examples and work with you on that. If it is a policy issue, then yes, we'll route that over to policy and work with them. They do have an email address that you can send questions to, and I will put that in the chat as soon as I'm done talking. Let's see, the 835 issues that you're having, that's one I haven't heard, a back and forth with electronic versus paper. Diana Roof is our EDI manager. And so if you contact her at that extension, they'll be able to kind of walk you through that.
And we did, real quick on that one, Shandy, we did have some issues early on with some of those 835s and kind of that process there where we were pushing some of those to paper, but we resolved that in a previous release. So if you're still experiencing that, definitely reach out to Diana. Jen, do you want to talk a little bit about kind of where our call volume and what the process we changed there and kind of where we are right now, usually our average call times?
Yeah, and Em is here right now, and she can probably give us a snapshot of exactly where we're at right this second, but we did make some adjustments on August 7th to our phone lines. We were hearing from providers that there was a very long wait time, that there were some calls dropping. I haven't heard much that that's still the case. If you are experiencing any call drops while you're waiting, please reach out to customer service and let them know so that they can let me know. But for the most part, I think we're sitting at about 10% abandon rate with, what's the minutes from?
That's
For
correct.
today.
It's about 10%. Today, I actually haven't been in because the phones actually just came up at 11. So it looks like we have 18 waiting on hold. It does typically tend to be a little higher on Thursdays just because of that 3-hour closure. But typically we're not seeing anything over 15 calls waiting. The last I saw yesterday was about a 19-minute wait. So we have dramatically, we're really rocking it. I can say that we're really trying to get these calls through and helping the ones that we really do need to help. So yeah, we're doing a great job.
Great, thanks, Sam. We're working really diligently to staff our phone lines. We've added some more resources, and we're, processing claims also with additional resources. So we are really trying to just stabilize and get things into an organized effort, and hopefully not have so many calls and questions come through, but it's a learning curve for all of us. And we really do welcome those questions. There is a Prism email that you can also send, and there are folks that manage that and can route to the appropriate person. The more detail that you give us and examples, the better we can be at getting you to the right area. Sometimes generalization is not the best, but it is a protected email, encrypted email, and we can get those questions answered for you. A lot of questions are coming in right now. I don't know if others who we've answered those questions already have any additional ones, but
Shandy, at the questions, if I could just help you
Sure.
with your talking. Just starting from the bottom, my ER claims are denying the UB04 as duplicate.
Yeah, I think that a lot of these things require detail, and our customer service staff are the ones that we've trained and are educated in the Prism system and the processes and procedures and the edits. So I think you really need to just reach out and work with us directly with claim examples so that we can have a better, visibility into what the main issue really is. I've got that information in the chat. I'm just going to reiterate. I apologize. It's not 334 or 332. It's customer service is option 3, provider, option 2 for medical, dental, inpatient claims, things like that. And then 2 again. Provider enrollment is 3 and 4. There isn't a second number there. EDI is 3 and 5.
One thing, real quick, Shandy, just to mention, I think on that too, is just one thing that we're seeing a lot of times there's not like a unique situation that's like, here's kind of the bucket we can throw all of these in and that resolves the issue for the providers. Just because the way that our old system really did not have all the filters, NCCI editing, everything else that's in there, right? So it's became much more complex in terms of Prism and the processes and enrolling as a provider correctly, submitting claims. And we've tried to put a lot of that information out there in the MIB articles, and that's also there as part of the links, also in our provider trainings of how to navigate and use the system. Because it can be that your provider's not set up. And so for one provider, they may call in with this specific issue, and it may be that their provider wasn't set up right. You can have another provider's experiencing almost the same issue, but it's really just how they've submitted their claims. And so that's the reason why it's best to work with our provider, with our customer service group, and they can walk you through and show you kind of what it is in your scenario that's causing those issues. I saw that there was one for an 835. I think I saw flash up for pharmacy that I'd responded a little bit to earlier. That the 835 for pharmacy is scheduled in our September 13th release. And that was a change request that we have for that. So that's looking like it's still on track for September 13th.
And we have some time. I know people have put in like the chat, if you want to verbally describe some of your questions as well, because they are coming in fairly quickly here, it might be helpful.
Jen, I can take the one on the value code 80. So there is a workaround on this right now. We are aware of the inpatient denials on these. We are manually processing those. Is that correct, Emily?
That is correct. They were actually suspended and they, from what I am told this morning, the RISE team are actively working those claims.
Okay. So we are aware that there is an issue there and it might just require a little bit longer adjudication time than our usual 1 week processing. So if you'll just kind of be patient there and see if you start getting those payments through, we are manually working them. Lindsay, thank you for the comment on the UB and the 1500. I think that's a great training issue. There are some new staff that may not know the difference between the UB and 1500. And a lot of times it might be called something different, that even though we know those are the standard terms. So Em, if you want to take that back and just make sure that your staff are educated there, it might be helpful. We use a lot of professional claims, inpatient claims, outpatient claims. So they may not be that familiar with that. So we'll do better at education there. The one regarding Tad Purser, I think we could just reach out to him, Jason, right?
Yep.
Individually.
Follow up with him.
Okay.
You know what your specific questions have been around that? Carrie? Or what facility, or if you want to post. So if you want to post your contact info and the facility, we'll reach out to Tad on that one. I think that was Carrie, you had that one, right? Yeah.
And I can actually answer the question from Parkway Dental about the PAs not coming over electronically on the claims. We have actually had an issue with their clearinghouse sending the prior authorization in the wrong loop. So they can actually reach out to EDI and Diana Roof can help them with their clearinghouse, but it is a lot of dental claims, depending on who their clearinghouse is. A lot of claims coming from dental exchange are a huge issue. So they certainly could call EDI and talk to Diana.
Okay, thanks, Em. I'm just looking through here. The
Thanks, Carrie.
let's see, and it looks like Tiffany is answering some of the questions right now. So let's see, do inpatients need to be resubmitted, or are you retroactively working these primary denials? Are you talking about the value code that we spoke of earlier? I don't know if people are able to speak on here, or is only comment?
They're able to speak, they just need to unmute.
Okay.
Yeah. Okay.
Thank you.
That'd probably be helpful.
Yeah, I think it would, to just kind of interact a little bit with you folks and get a better sense of what's going on.
Okay, can you hear me?
Yes.
Okay, so we've submitted all of our inpatients back. We just need to know if we need to resubmit them as a corrected claim, or you want us to leave them alone and you're just gonna go back and fix them from the beginning. We have so many that just aren't paid that we're just concerned. And when we call, make that correction to the value code 80, they're still coming through as a denial.
So Emily, is there a process? We have to go through a step process of, is it, this and this match, then we force the claim through. If it's this and this, then maybe the denial is a true denial. So there are some checkpoints, but I don't know if you can speak to this, Emily. We are working if it is eligible for payment, we are working the claim that's currently in the system. If it is a denial that was billed incorrectly, you'll need to submit for those. Do you have any other thoughts on that, Emily?
Without actually looking at the claims, it's really hard for me to say. Do you want to send me some claims examples? And, if we even need to set up a meeting, we can certainly do that, but it's easier to see the claim and for me to just say, yeah, it's denying correctly. I honestly don't know.
Okay,
Yeah.
do you have a contact information that I can contact?
Yeah, of course, let me put it in the chat for you.
Yeah. And I just want to make just a quick disclaimer that Emily is a supervisor over customer service and her time is extremely valuable. I don't mind if people need to reach out if they've gone through the protocols of customer service and really tried to work with us through those jobs. If you feel like I am not getting anywhere, rep is not understanding, then yes, reach out to Emily and share that opportunity with her for some training. But please utilize her email respectively, and let's try to.
I
Yeah.
appreciate that so much. And I do have 2 leads that I can pass things off to as well, because I am overwhelmed right now, but I will just send them to me, and I have lots of resources. So if you don't hear from me, you will hear from one of us.
Yeah. And we do want to know what you guys are experiencing and what we can do to help train our staff and educate them. Like I said, there are a lot of new people and some turnover that we've experienced, but it helps us to better prepare them for the questions that come in so that you're not having to constantly go up the chain to get those questions answered. Let's see what else was on there. Yeah. Lindsay, like you said, I mean, we'll do what we can to kind of help triage your questions now. I don't mind if you need to reach out to Emily and share those examples, but again, we need the specific claims to kind of go through some of that. Is there anyone else that had a question we didn't answer that we didn't get to?
Let's see, Tiffany, do you want to talk just a little bit about how Prism handles denied claims? I think you'd responded to that one in there, but you want to just talk through it a little bit for this group?
Yeah, sure thing. So in Prism, we actually don't allow corrected claims for denials. If they are paid, you can of course correct those, but if the claim is denied, you just need to submit a new fresh claim with all of your corrections, and they should come through just fine.
Thank you. Scanning through the list real quick, see if we missed any. Don't see any, I guess that's any other questions that you guys have for us? Or Phil, we need to give you more information on some of the questions, or?
I was just wondering, Austin, do you think you can capture in the chat all of the phone tree information that was given?
Yes, I am
And
planning. to
maybe
send
make that
yeah.
available?
I
Thank
can
you.
actually send you the phone tree, the most current phone
thank you,
tree, if you
Shelly.
want me to email it to you. It's a little bit busy, but it will give you a good idea of how to get through. So
Let's do
if one person can give me their email and then send it out to this group.
Yeah, Shandy, I'll message that to you right now.
Okay.
Thanks, Austin.
So if there aren't any other Prism related questions right now, I think I'll just give another update around some upcoming policy changes. And again, this is in the formal presentation, but I will walk through some things that are happening with the Medicaid program in the next few months. January 1st, there's several different updates to eligibility that we want to share with you. The first thing is that children will, when their renewal occurs after January 1st of 2024, will have a 12-month continuous enrollment. This was a requirement of federal legislation called the Consolidated Appropriations Act, and we will be implementing 12 months continuous eligibility for Medicaid eligible children. CHIP children already received 12 months. This will be 12 months for kids. The next item we're looking at is our postpartum coverage. Today, our postpartum population receives Medicaid coverage for 60 days after delivery. There was legislation that went through this year's legislative session that did introduce a pathway to move to 12 months continuous eligibility for postpartum care in individuals. So it would take it from 60 days to 12 months. We are still working with CMS on final approval, but our our roadmap is looking at going live with this on January 1st. And that would be, again, continuous enrollment for another population, which would be our pregnant population. Another change that's important to call out is a new population receiving services. And this is a CHIP benefit. We are calling this benefit the state CHIP program. This program also came through this past year's legislative session. It is for children who are undocumented and meet other eligibility criteria. We are, because this is a new program, it is all state funds, because it is for undocumented children. It will serve more than 2,000 children based off of the funding that we were able to receive. And it will be open on January 1st in an open enrollment application. We recognize there is a fair amount of community interest. We've been working with Senator Escamilla, as well as our managed care partners who run our 2 CHIP programs through both Select Health as well as Molina Healthcare to be ready for this. We are going to be putting a number of materials public facing by October 1st. That will be an FAQ as well as other resource documents to help families and providers be aware of what this benefit is, how people apply, and to answer some commonly asked questions. So we are working with some advocacy partners right now on the development of those materials and hope to have those ready by October 1st. Last item I'd like to note for a January 1st change is something CMS required, which was changes to our non-traditional benefit. So today there is a non-traditional benefit package, and CMS has required that we no longer offer a more limited non-traditional package, but actually transition these individuals to a full traditional Medicaid package. What that means for you as providers is that these individuals will now be eligible to receive non-emergency medical transportation, as well as more extensive services like vision, physical therapy, occupational therapy, and chiropractic services, and then a couple of other items. They have been able to receive a limited PT/OT benefit, but this is more visits that's aligned with our traditional Medicaid package. So it does give more services to this population, which is nice. And that will also go live on January 1st as well. So just a couple policy updates to have available because there are so many changes happening with the program right now. We wanted to keep you abreast of those changes as we're developing them and as we're preparing for them as well. The dental coverage, so let me talk to dental. Right now we have this will not have a direct impact on dental. What we're looking at and what came through our last legislative session with regard to making our dental services available to all adults actually came through a waiver. Right now, for our adults, we have dental available to our pregnant population, also our EPSDT eligible population, our aged, our blind and disabled population, and also TAM individuals who are going through a substance use program. What the legislation last session will permit is allow expansion for all adults that are enrolled in the Medicaid program to receive dental benefits. This is because it's a waiver, it's an application we have to submit to CMS, and it takes a little bit longer to get approval for that request. It has been submitted. We submitted this request in August, and now we'll be working with CMS to get that approved. So the transition to traditional is not directly affecting dental because it's an optional service. It will allow dental once we get this other request through the waiver approved through CMS. So coming soon, dental services for all adults will be coming soon, but not approved under the authority of CMS quite yet. Are there any other questions? Okay, postpartum. It's the full postpartum benefit. So the entire postpartum benefit, so the pregnancy category that that individual is during their, pregnancy and then postpartum, it will be the same coverage package that will now be extended from 60 days, a whole Medicaid pregnancy benefit, from 60 days to 12 months postpartum. So it's actually full coverage. It's going to be great. We are going to be monitoring outcomes for this population. We want to look at the impact that it can have on postnatal care, including chronic disease management, physical health, behavioral health, substance use, adherence as well, and evaluate this for some outcomes. So from the start, we're going to be looking at how this change can really improve the lives of women who have delivered a child and are now able to access healthcare for a longer period of time. Thank you for the question. If there are no other questions, it is the top of the hour. I do want to close and just, first of all, again, thank you for being Medicaid providers, for engaging with us in the work that we all do, taking care of a very vulnerable yet very deserving population. And want to just thank you for participating in this call today. I know it's been a challenge with all the system changes that we've had and introducing so many different things to you as Medicaid providers with our new system. We know it's going to bring improvements to our program and certainly improving the ability to monitor and oversee the population and deliver services. But certainly that learning curve has been something we're all going through. So thank you for working with us on this effort. We're here to support you. We gave you many different ways to reach out to us today. So also happy to have another one of these forums in the future as well, if that's helpful. So thanks to my team who joined on the call today. Thank you for all of you who joined as well. We appreciate you. And thank you again for supporting the Medicaid population. Have a good day. Thanks, everyone.
Yeah, thanks, guys.